everybody, I'm Vicki Liviakis, and welcome to Body Beautiful. This is the show where we chit-chat with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. This is a live show and interactive. With us today, we have plastic surgeon Dr. Joseph Mele, and we're going to be talking about breasts, breast augmentation, and breast augmentation revision should something go wrong. Later, we'll be taking your calls, answering any questions you might have. Here's the phone number, 415-561-8753. We'll also be posting the number to the doctor's office, so be ready to jot that down. And our little caveat we always use before we get started here, any advice we give you today, you'll certainly want to consult your own physician. Let's just jump right into it. Love having you on the show. Welcome
Good morning.
back.
Nice to be here.
All right. We're just getting past summer. When you're in a bathing suit or those skimpy little dresses, breasts are very prominent. People get to be thinking about that.
Sure.
You know, given the economic climate, are people still going out and getting breast augmentations?
People are still getting breast augmentation.
So, how many per year?
And it's not just so much to make a statement, but it's to help the way the bathing suit fits, to help how clothing fits, and to balance the body out, especially after childbirth or weight loss.
So, a lot of it's really self-esteem issues?
It's self-esteem. It's just feeling good about oneself.
Yeah. Well, if you go to
and the only reason to do it is for yourself, obviously.
Exactly. Yeah. Well, and then it might please your partner, but basically
you
have to be happy with
that's a secondary byproduct that's beneficial.
So you go to the supermarket, at the checkout stand. I mean, you can't help but see all the magazines with, from the Kim Kardashians to the you name it, right? And everybody's wearing, you know, revealing dresses.
Revealing clothing, sure.
Yeah, I mean, cleavage just seems to be still a big deal, fashion-wise anyway.
Well, it's one of those defining feminine features too. So it's something we accent.
Yeah. So, you know, you're waiting to check out, and there it is in your face. Yeah. All right. So breasts have always culturally been something that, you know, we've admired, and so people like you who make beautiful breasts, later on we're going to be showing pictures of some of the work that you've done. Why do people, and because we had talked about this earlier, get breast augmentations and then corrections? What can go wrong somewhere down the line?
Well, I think it's important to know that if it's something you're interested in, definitely want to do your research, find out, you know, what's good, what's bad, what are your options, and find out about your doctors if they're board certified, and make sure they have experience doing the procedure, because there are things that happen routinely with the procedure that may require revision. There is some maintenance involved, and that should not be a surprise when it happens. It should be something you're able to think about beforehand and say, okay, this is part of when I go down that road, and I may need to fix an implant because it deflates. I may need to change an implant because I decided I want to change the size, because they don't change as we change, and as we get older, our breast naturally may atrophy or may get larger, and it may change the amount of augmentation that we want to do.
Oh, you see, I didn't know that. So breasts get larger when you get older?
They can, well, especially if you're gaining weight. Breasts are mostly fat, so sometimes the breast will get larger along with it. Normally what I'm doing is keeping things in proportion. So if someone's very thin, we're usually not using as large an implant in order to make, you know, a nice change, a nice statement in terms of how their breasts look compared to the rest of the body.
Now the
so it's balanced.
The statement here is much different. The aesthetic in the Bay Area is much different than, say, Miami or Los Angeles or anywhere else.
Sure, I think there are definitely regional differences just in terms of the numbers of cc's that we use in the implants themselves. But I think, and it is somewhat cultural. But a lot of my patients are women who have had children, and they may have been a C cup before they had children, and after children they're barely a B cup, and they want that back. So we're really just correcting what's been taken away.
So when someone decides to, say, bump up, what's the average cup size that they go to?
I think most patients are going up at least 1 cup size, sometimes 2. And there's definitely an upper limit, not in terms of what's possible, because we can certainly put a large implant on anyone, but I think in terms of what's going to be proportionate, what's going to fit in clothing, what's going to look undone, because unless someone's really trying to make the statement that I have huge implants, they're probably going to want to have some upper limit that's going to look okay on them.
I mean, what role do you play in that decision making? Have you ever sort of talked somebody down?
Sure. I think that's important, because just like my patients who come in and want breast reductions, if we make the breast too large, I can cause someone to have neck pain and back pain and rash under their breast because the skin's folding over. A lot of the unpleasant things we just don't want to think about
Sure.
can occur if we make it too large. Plus, the weight of the implant can stretch out the skin, require a lift in the future or some other revision just because of the large size.
Okay, well, we talked about this before. We have some photographs coming up. We need to take a quick break, but for more information about Dr. Mele, you can call him directly. That number, 925-943-6353, or check him out on the web at drmele.com or on sanfranciscobreast.com. We'll be taking your phone calls and show you some before and after pictures when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.